Hello, hello, hello. Testing, testing. How's everyone doing? So, I am just here at a conference, and it is a sports medicine conference, and I am just here to answer some questions in between sessions to see if anyone has any questions. It's been some time since I have actually done a live, so just wanted to make sure anyone has any questions. I can answer your questions about hip injuries, shoulder injuries, or knee injuries. I'm an orthopedic sports medicine surgeon. I'm currently at a sports medicine conference where I'm attending lots of sessions on different techniques and innovations on the latest and greatest surgeries. And I just want to spend about 25 minutes talking to people, get some questions answered if you have any questions. Thanks for comment if you have a comment about any kind of injury of the hip, knee, or shoulder. Those are my areas of expertise. So those are the questions that I usually answer. And I'm happy to talk to you guys about anything. So far, I spent the day, all day in sessions learning about new techniques in surgery for mostly shoulder and knee injuries. And then I did a lab before I have to go to a session again. So let me just get started. Again, if I don't get your question answered, send me a DM or follow me, and I'll be sure to answer your question at some point. Thanks for asking. So the question that you are asking really refers to an abnormal shape of your socket in your hip, and that causes a socket that does not hold the hip properly. And so stability meaning your hip feels loose and you have pain associated with that. That would be a reason for getting it fixed. And if it is occurring on both sides, I recommend getting on both sides. Thanks for your question. Krishna says, how's life as a sports medicine doctor? A sports medicine doctor has a great life, I think, because as a former athlete, I enjoy taking care of athletes. And that's pretty much what I do as a profession. So if you are someone who likes sports, who plays sports, people who are recreational athletes, people who are serious athletes, or service for people. Performed to fix the alignment of the leg to give you recovery tips. If you have a ruptured Achilles, there really is two options for a torn Achilles. You can get it fixed with surgery, or you can do physical therapy to get a recovery over time. And they've done studies, and if you're not a high level athlete and you really do not need to have significantly strong legs to do daily activities, they've done studies where you have very good outcomes for non-surgical treatment for an Achilles tendon. getting a surgery will give you that function that you're looking for. Bryce Bernard. Wow, good to hear from you. I know you. Hopefully you're doing well. I actually think about you all the time. So I do think about my patients, but good to hear from you, Bryce. I hope you're doing well. The recovery process can take anywhere from 9 to 12 months to longer, depends on how long you're able to, how long it takes for you to really recover your strength and your functional status. The reason why it takes so long is that the actual ACL that is reconstructed inside the knee can take months to recreate the previous ligament that was torn. So what happens inside the knee is that the reconstructed ACL undergoes a process known as ligamentization, and that is where the reconstructed tendon that you put in the knee actually turns into a ligament inside the knee. And that biologic process takes about 9 months. And if you go back to your sport before that result tear. So that's why the recovery process is at least 9 months in my book, and it can take longer. Depends on how you feel, because sometimes when you tear your ACL, you can have psychological impact from that and be intimidated to go back to your sport. So there's a lot of factors to why it takes so long to go back from an ACL. AK says, I dislocated my patella 2 months ago and still can't straighten it. Any tips? If you have a dislocated patella that is symptomatic and continues to be symptomatic, I would definitely first see an orthopedic surgeon, obviously. And usually what I do for a patella tendon instability case, which this is what that sounds like it is, you would do physical therapy for a while. If you can't straighten it, that definitely means that there definitely is a block to your motion that should be addressed sooner than later. Want to have who have shown that they've done some time in a hospital setting. And what I did some volunteering in a hospital where I was actually in the hospital OR. And a lot of hospitals have volunteer volunteer applications that you can do volunteer communities. Or a message or a comment or something. Alex Hoffman says, I'm 10 weeks post Tommy John surgery. What's a way to get rid of the scar tissue that has developed? So scar tissue, really, I think you are referring to stiffness in your elbow. Prevent is to continue motion after surgery. So that's the best way to prevent it, actually, is motion. CJ Moore says, interested in ortho, beginning M1. So this is a medical student who's just beginning the journey. So I would say if you're interested in orthopedics, the best thing to do is to do some orthopedic surgery research. That is the commitment to or scientific work. And in addition to the research, you should do work with orthopedic surgeons and shadowing, and just do a good job in medical. So if I don't get your question, please send me a DM. And I'm just going to answer questions about shoulder, hip, and knees. Sipping around. Cole Darling said, I tore an ACL a year and a half ago and still don't have all my strength back. Is it? Sorry. Yes, Ryan, fun at AOSSM. I would see you soon. Um, Everyone's different in terms of their recovery after an ACL. What I typically would see after an ACL tear, I would expect most of my patients to be able to go back to their sport by 12 months, but not everyone is the same. If you don't have your strength back, then it depends on the graft that was used. It depends on a lot of different factors. Feel like you still are lacking in a way, I would definitely recommend seeing an orthopedic surgeon and investigating if there is an actual heel on. My doc said mine. The environment that the ACL is in when the injury occurs, and that is the ACL when it is torn, it is subjected to the joint fluid, and the joint fluid is not conducive to healing. So it is very rare for an ACL to heal on its own. If you were told that your ACL know that the rich plasma is taking a blood sample from you and it goes into a centrifuge, and the centrifuge spins down that blood sample and concentrates the platelets into a fluid that can be injected into your knee or whatever body part is causing pain. But the because it causes some inflammation. So bottom line to that question about if your running is taking a long time after PRP injection, you have to take your time because you can't rush the process. It is a natural process where there's inflammation and pain, and you may have to take Tylenol or even ice the area to help with pain, but really it's depending on how your pain is afterwards. Any other procedure with the ACL? He was surgery, and secondarily, if you had appropriate physical therapy after the surgery. So it is physical therapy, but it will require a lot of work to get your range of motion back. Again, if I miss your question, send me a DM. Claire Abbey says, what are the top techniques for a question about what do pro athletes have at their disposal in order to prolong their career? And that basically is the answer to that is they have access to some of the best nutritionists, the best strength and conditioning coaches. They have great diets. They have great access to the best equipment for that really the typical person doesn't have. So they do typical have because of the constraints of money. So it really is a matter of they have the best equipment, the best coaches, and the best strength and conditioning and nutrition. That's basically, I think, what it boils down to. Um, So Alexa says, what if an MRI doesn't show any injury, but I still feel my knee getting stuck? I can't answer your question specifically, but I'd say that a of a meniscus injury that is not being well visualized by an MRI, but I can't answer your question specifically. I'm giving well a sore shoulder, sore viable shoulder. So KT tape is a way to support the musculature and skin around an area or a joint. It does give some support to a injured area. It can be a good technique to use for any kind of ailing body part. So Kelsey Slater says, I had ACL surgery in April. I've had a constant deep sharp specific situations since I'm not your doctor. And I would say if you have pain that is constant and sharp behind your knee and it hasn't really improved over the past, was it 3-4 months, it is worth getting evaluated by your but it's very difficult to tell you based on those symptoms that you told if you have a definitive issue. But I would say if the pain is behind your knee, then it could possibly be a meniscus issue. Christian says, I tore my labrum. What should I do? It can cause pain, especially with weight bearing and a weight intensive activities. Usually what I tell patients when they tear their labrum is to try physical therapy to see if that improves it. If it is a labrum tear because of instability, like you dislocate your shoulder regularly because of your labrum tear, then you might need to act on that quicker if you have more and more labrum tears. Sorry, if you have more and more shoulder dislocations, then it might require adhesis, distal clavicle, exploring a Latarjet. So what is a Latarjet? So Latarjet is a stabilization procedure for the shoulder in which you take the coracoid, which is a bone in the front of the shoulder joint, and you move that bone to become an extra bumper to the front of the shoulder socket. So it stabilizes the shoulder by giving it extra volume, so to speak. It also tightens up the soft tissue structures around the shoulder to give it stabilization. So it is used for people who have had multiple shoulder surgeries like you, or people who do a lot of high collision sports that need a more stable procedure for their shoulder dislocation. Shanae Jackson says, why are you in a motel? So as I mentioned earlier, I'm at a orthopedic surgery conference in Denver, Colorado right now. I'm in a hotel room. I'm in the middle of a day filled with going to conferences or meetings all day about different orthopedic invention or innovations in surgery and talking to colleagues and doing labs. And I am not at my home right now, so I'm in a hotel, not a motel. Thank you. And I am at a conference, so that's why I'm a little bit dressed up and out of my scrubs, and that's why I'm in a hotel room right now. But thanks for your concern. Happy birthday, R of 1042. So Trey says, any advice for a sophomore pre-med going into surgery? So I would say my advice would be to continue doing well in school, but also develop extracurricular pursuits, because medical schools like a well-rounded student who is not just a science person. So develop your extracurricular pursuits, but also definitely do well in your sciences and keep an open mind. You're still kind of young in your educational career, and your interests might change, but I'd say continue working on your pre-med sciences, but also working in extracurriculars and do some research as well. Jared says, where do you go to med school? I went to Harvard for medical school. Alexa says, is there any torn cartilage symptoms? So torn cartilage, especially in the knee, can cause pain, obviously, but also a swelling in your knee is a very good sign that you might have torn cartilage, amongst other things. But really, telltale signs of cartilage tear or cartilage injury is pain and swelling. Haley asks, where am People are asking me why am I in a motel room? Yes, I'm at a hotel because I'm at a conference out of town. So Christine Seguenza says, hi doc, if a patient undergoes viscosupplementation, what's the aftercare? So viscosupplementation is gel, basically. Or I think some people I might have bad reception. Um, so Kraus asks, how long do you think it will take me to be able to walk after MPFL reconstruction? So MPFL reconstruction refers to medial patellofemoral ligament reconstruction, and that's for people who have patella instability. And really, you can walk right after surgery. I mean, the surgery is not for a weight-bearing aspect of the knee, so that means you therefore can walk after surgery. You can't put your full weight on it, but for my patients that have the surgery, I allow them to put partial weight with crutches right after surgery. And so if you're talking about walking normally, that might be 6 weeks without crutches. Again, if I miss a question, send me a DM. I have like 1 minute, so like 2 more questions at the most. So Alan says, doctor took out half of my meniscus. What should I look out for in the future? So the meniscus is a shock absorbing aspect of the knee, and you want to keep as much as possible. When you have loss of that shock absorption in the knee experiences more shock over time, and that can lead to changes like arthritis. So unfortunately, when you have a lot of arthritis if you have a lot of meniscus that's removed, you may be more likely to have arthritis sooner than later. So this is my last question. So last question, really the issue with shoulder impingement or any shoulder problem for a thrower is that the problem begins not just in the shoulder, it is the whole chain of throwing. So the throwing motion from the hips up all the way through the elbow. And so many times with shoulder impingement, a lot of people have what they call a gotta go, guys. Thanks for tuning in. Again, if I miss your question, just send me a DM. I'll look forward to answering it in the future. Take care and have a good day. Sorry, I'm trying to end this thing. Thanks, guys. See you.